All right, this is the patient care panel. My name is Helen Wilson. I'm an advisor at Wayne State, pre-nursing, pre-vet, and pre-optometry. I want to welcome everybody to the patient care panel. And I want to have each participant who's a panelist introduce themselves, and then they're going to answer some questions throughout the panel. If you have questions, feel free to write them in the chat, and we'll make sure that we get to them at the end of the questions that I sent out to everybody. So we're going to go ahead and start to my left with Christine Smith Johnson, and I'll let her introduce herself.
Hi, my name is Christine Smith Johnson. I am with the Karmanos Cancer Institute. I am the volunteer coordinator. Welcome, everyone.
And then Nancy, I'll let you introduce yourself.
Good afternoon. I'm Nancy Carlisi. I'm Senior Director for Volunteer Services for Corewell Health East, formerly known as Beaumont. So I will be able to talk to you today about any of the 8 hospitals in our system.
And Brittany, I'll let you introduce yourself.
Hello, everyone. My name is Brittany Thomas. I am a nursing advisor here at Wayne State University. I advise all of the traditional BSN students. So if you all are possibly pre-nursing students interested in beginning the BSN program, I would be your advisor in the future.
Okay. And Maureen, I'll let you introduce yourself.
Hi, everyone. My name is Maureen Stiles. I'm the manager of Child Life and Volunteer Services at the Children's Hospital of Michigan.
And Nicole?
Hi, my name is Nicole Yost. I am the manager of volunteer services for Henry Ford Health Cancer.
And Deborah?
Good afternoon, everyone. My name is Deborah Holland, and I am a pre-medical advisor with the Office of Diversity and Inclusion at the School of Medicine, and I also serve as an admissions committee member with the School of Medicine.
Okay, thank you all for those introductions. Now we're going to start with a little bit of information about each of your volunteer services in terms of what you actually have to offer. And I'm going to start with Beaumont because we're starting at the top of the alphabet here. So Nancy, tell us what Beaumont has to offer for volunteer opportunities.
So we have a lot of different opportunities. Obviously, since the pandemic, some of those have changed a bit. But we were fortunate enough to start bringing volunteers back into our hospitals in May of 2020. And so we've been building our program since then. We took a lot of time to really look into what needed to change in the volunteer role, what needed to be added to their training to keep everybody safe. And we were able to put that into motion in, like I said, May of 2020. So right now, we pretty much are back to having most of the opportunities that we had pre-pandemic. One of the biggest opportunities for people who need patient contact, we have at all of our 8 hospitals opportunities on different types of patient units. Do you want me to go into all the different opportunities at this time, Helen, or
maybe just mention a few and then we'll come back for more details.
Okay, let me mention some of the patient contact ones. So the patient units are one of them, and I can go into a little bit more of the details of that position later. Patient escort is a big one too at some of our hospitals for discharging patients. In the emergency center, we have a couple of different areas available in emergency center, either with patients, getting them comfort items, kind of taking care of families and doing the wayfinding, stocking. Actually, the emergency center was one of the first areas we brought volunteers back to during the pandemic, because as you know, our staff was extremely strained with the volumes coming in. So our volunteers at that time did not have the patient contact, but were a huge help in keeping all the stock updated in all of our pantries and all of our supply rooms, because they would go through them so quickly. So the volunteers were really indispensable during that time and played a key role there. We also have some opportunities for people who may be interested in therapy, either physical therapy, occupational therapy, speech therapy. So we do have opportunities there. And then also in our surgical areas, so both in the lounge, in the pre-op and post-op areas, working alongside patients, families, and staff. Anyone interested in pharmacy, we do have volunteers in outpatient pharmacy, helping a lot with the meds to beds program and just at the counters in the outpatient pharmacy. And then we have a couple of opportunities in endoscopy and in the cardiac cath labs and mammography. So that's, I'm just kind of covering briefly some of the patient care areas. Another area that we added a couple of years ago was the central processing department. And people tend to turn their head at that because they're like, oh no, it's not around patients, and that part is true. But what you learn in the central processing department is all of the different medical instruments and equipment that is used, and volunteers are a big help with that in actually transporting them to the different surgical areas for use in surgery. So the students that have participated in that department has really loved it because they've learned a lot about that piece of it. So I can go into more detail later if you want, Helen, but that's kind of overall.
Okay, and it sounds like quite a variety of different opportunities. Okay, and if you want to write in the chat, like if a student is hearing something and wants to know like how to get involved, feel free to write in the chat, like go here to apply or something like that. Okay. Maureen, I know that we have a lot of interest from our Wayne State students in working with children, and I hear a lot about, I want to work with children. So I know we have a special link to share that, you know, Desmond is going to share, but tell us overall, what can students expect working at, you know, volunteering, I mean, at Children's Hospital of Michigan?
Sure. So much like Nancy was saying, we were able to bring volunteers back after COVID as well. Ours took a little bit longer, so I think it was August or September before that happened. But since that time, kind of similar to Nancy, we have revamped some things. So we've implemented a tier process or tier placement process to help just orient people a little bit differently to the hospital. So moving in some of our tier ones are in the emergency department or have limited patient contact, and then moving up our tier to providing interactions in our activity centers and bedsides, and then finally in our ICU settings. So we do have both clinical and non-patient care opportunities in all of those tiers, which is what I call them.
Okay. So quite a variety, it sounds.
Yes.
Like, both clinical and non-clinical.
Yeah.
So
and I can share my slideshow, but just let me know when it is an appropriate time.
Okay. So you can share it yourself then? You don't?
Okay. Yeah.
Or should I make you a co-host?
No, I gave them access to share it.
Oh,
yeah, it looks like I can do it.
Okay, go ahead then. Thanks, Desmond.
The slideshow is always a little bit strange, so I'll keep it in this view. So at the Children's Hospital of Michigan, our goal is to provide the best care and comfort to our patients and families, and this is a big part of how our volunteers play into this. So a couple ways to be involved is to complete a service project, which we'll go over later, small group volunteering, and then to actually become a CHM volunteer. The first two, I'll send out the slideshow so you guys can kind of go through that on your own. I've already submitted to Helen, but let me just dive into the actual being a volunteer here at Children's. So we have over 30 placements available 7 days a week. It is very customer service based. So like I said, both clinical and non-clinical roles are available. And then we utilize a tier system for training to provide opportunities for growth. So additional placements, so moving up that tier placement, up that tier, and then also opportunities to become a mentor volunteer. And then just so you know, some comments from our volunteers right now. When volunteering in the sixth floor playroom, I marveled at how even the very sick kids had fun, and for a brief time we were able to forget about needles and tests. Also, providing bedside visits gave parents a much needed break and someone else to talk to. So those bedside visits and activity center time are very common for our volunteers to fall into those roles. Some of our requirements is being able to commit to 3 hours per week, and then a minimum of 100 hours of service within a 12-month period. We do not write any letters of recommendation for anyone who has less than 100 hours. We always want to encourage students to consider all their other obligations to school, family, work, other volunteer positions, any extracurriculars or major life events that are coming up. Our onboarding process is driven by the volunteer. So once you complete one step, you get the next step and the next step, but it really does take that initiative to follow through with those things. We have our volunteers complete an informational session just so you can learn more about that. It's very similar to the information I'm providing right now. Also completing LearnShare modules, a background check, and then obtaining medical clearance from our occupational health department. Flu shots and COVID are required. We do not have any capability to waive those for anyone at this time. And then we have all of our volunteers go through a 1-hour virtual orientation and then sign some paperwork about hand hygiene and statement of agreement. Our badge and uniform cost is $20. And then they also participate in a 1 to 3 hour mentoring session, depending on where they're placed. Our onboarding process does take a little bit of time to complete, somewhere around between 2 and 4 weeks. So if you're looking to start volunteering in January, this is a great time to submit your application because we can start that process so you can get started. And I know you talked a little bit about this, Helen, too, just the COVID-19 precautions that we adhere to. So all of our volunteers and employees are required to be vaccinated. Masks are still required for hospital entry. So this is for volunteers, patients, and families. We ask that everyone self-monitors for COVID symptoms. And then for placements that have patient contact, the following PPE is required. So surgical masks for everyone, proper hand hygiene, any additional PPE for any bedside visits like gowns and gloves. And then we are also encouraged, if people feel more comfortable wearing an N95, we make sure that everyone is tested prior to the starting to being a volunteer. And then a little bit about our tier program so you guys can see. So first tier has a lot of different choices, but things like wayfinding escorts, reception desks for surgery and radiology, some clerical jobs, working in our clothes closet that provides clothes to patients and families in need here, rehabilitation, pet therapy for our lobby, our admitting department, being a greeter, audiology and speech, over at our specialty center, which is just across the street from the main hospital, working in our general pediatrics clinic, and then also rehabilitation over there, and then helping the child life staff do activity kit making. So as you move up the tiers, here's tier 2, which are mostly our activity centers, the more patient interaction that there is. Our tier 3 is very heavy on bedsides. So things like being on our actual floors and surgery in the inpatient, huddlers for patients that are 2 years and under, special events for child life. As you saw in that first picture, we had our ice cream volunteers that pass out ice cream every Tuesday. So that's a really fun one. And then our technology cart, which gets video games and iPads out to our patients here for them to use. And then when we get into our 4th tier, it's kind of our more intense units. So bone marrow transplant, pediatric intensive care, and the neonatal intensive care unit. I think those are my biggest thing, but I have some frequently asked questions in here for the students just when they review it as well. Happy to answer any questions. There's information in this slideshow about service projects, small group volunteering, and then also the our volunteering process.
I was wondering with the 100 hours, would they finish tier 1 and be in tier 2 by that time?
Absolutely. So it's by 30-hour increments. So once you hit 30 hours, you're able to go into tier 2. Once you hit another 30 hours, you're able to go into tier 3. But of course, some people really like their tier 1 placement and choose to stay there the entire time. And that's also absolutely fine.
So you could stay in tier 1 or tier 2.
Yep, sure.
Okay, all right.
Any questions that I can answer before I close this?
Students, any questions? You don't have to wait till later. You can unmute yourself or write your question in the chat right now. I don't see any questions.
Okay,
All
I'll
right.
be here just in case.
Okay. All right. Nicole, Henry Ford Cancer Institute. Tell us about Henry Ford Cancer Institute and what can students do there as a volunteer?
Yeah, so we do have locations throughout Southeast and South Central Michigan. But our main location is the Brigetta Harris Cancer Pavilion, which is in Detroit, right across the street from Henry Ford Hospital. So pretty close to you guys. And so that's where a majority of our volunteer opportunities are located. Our volunteer program for the cancer service line is relatively new. It was just kind of encompassed with all of our other hospital sites previously. And so in January of 2021, we opened the Brigetta Harris Cancer Pavilion and kind of launched this specific volunteer program. So we are still kind of developing. And right now we have 5 volunteer positions. They are all very customer service based and all have a ton of patient interaction opportunities. So we do have 3 positions in clinics. One's in radiology with our mammography patients, and then one in chemotherapy, and then the third clinic position is in our inpatient oncology unit, which is across the street in Henry Ford Hospital. And then we also have a patient resource volunteer. So we have a patient resource center in the Brigetta Harris Cancer Pavilion that patients visit to get information about supportive oncology services. So we have a volunteer attend that space and help patients as they visit with finding resources like support groups or events, things like that. And then the last one we call a patient experience volunteer. It's a really combination of kind of wayfinding and transport volunteer. So those volunteers do attend our lobbies, greet patients as they enter the building, and then help to escort patients to their appointment. But clinics also call down to those volunteers to help patients get from their appointment back down to the lobby or the parking garage. Super helpful for patients who come to us without a caregiver and are using a wheelchair. And I would say one of the positions that is most overlooked by volunteers, but one that really does provide a lot of patient interaction. You see a ton of patients and get to talk to a ton of patients in that role. And then also visit a variety of different clinics throughout the building.
So five different volunteer opportunities.
Yep.
Okay, great. Can you put the information in the chat, Nicole? And I can also share it with anybody listening to the recording too. You know, if anybody's listening to this, I'll be sure to have your information too to share to them.
Yeah, of course.
Okay. All right. Last but not least, Christine. Tell us tell us about Carmanis, and we're so glad you're here this year. And we have videos I know to show, but tell us in your own words, what can students do as a volunteer at Carmanis? I know we've had students over the years volunteering, and they're very grateful for the experience. So.
We have a number of rotating positions that they're able to do. So a lot of it consists of wayfinding, transporting patients between discharge areas, as well as from the front door throughout the hospital. So in terms of where they be assigned, it's rotating opportunities. So they wouldn't necessarily be assigned to one area. We like to give them a good experience throughout, like a complete experience. So what I'd like to do is, if we can show those videos, which are less than 3.5 minutes, we can do that, and then I'll continue a little after the 2 videos.
Okay. Desmond, are you ready?
Yep. I will share it now.
Okay.
Thank you.
Oh, 1 second, sir.
what we do every day to protect the staff, to protect the patients, because our patients are immunocompromised anyway. So, you know, we talk about hand washing, we talk about, you know, what they should do on the outside to protect themselves. And here I think we're taking all of the right steps.
So whenever I see a patient come into clinic, as an example, I try to find out what their fears are, what their worries are about what's going to happen in the world, and how we can help them cope with that, what information we can give them to cope with that, and alleviate some of the fears they have about what the pandemic may mean for them. We also try to assure them that we're continuing the strategies we're always using to treat their underlying disease, and nothing will change in essence of their treatment. We try to give them the best treatment possible.
No matter what happens, if something good happens, something bad happens, we'll be there. We'll hold their hand. We'll tell them that they're not alone, that we're all here. When they're in the hospital, they're my family member, and I will do everything what I can do to relieve their anxiety. And I will do anything towards my patient that I would do the same thing to my family. So I just want to make sure that they know that we're all here for them and they're not alone, not at all.
Would you like me to go directly into the next video?
Yes, please.
As a gynecologic oncologist, we have a very unique role in the medical field. We take care of the patient from beginning to the very end. We are very instrumental in the diagnosis of masses and of the cancer itself. And then we guide them through their surgery if it's necessary. And then even after the surgery, we will manage the chemotherapy, direct them to radiation therapy if necessary. And then we follow them for years. I see patients now that I've been seeing for almost 20 years. Probably the most notable patient I had was somebody who approached us. She was early in pregnancy with a newly diagnosed cervical cancer. And she's expecting, terrible impact on pregnancy and make a decision to continue with the pregnancy. Is this going to threaten or jeopardize my life? And this particular patient, we're able to manage her through the pregnancy, manage her treatment, both surgical and chemotherapy during pregnancy, such that she was able to be cured of the cancer as well as maintain a pregnancy. When I see patients, I say, look, as you go and leave here, I want you to feel more comforted than you did when you walk in. And I want you to have comfort that we have a plan, that there's hope, and most importantly, that we're a group of people that you can trust.
All right, thank you so much, Christine.
So with that, I would like to put emphasis on our desire to help the students to not only assist with the patients, but understand that we are dealing with a unique population, and also to help them to kind of get geared up to become the nurses and the doctors that they're aiming to be. So we like to focus a lot on communication. They are able to do that because as they're volunteering here, they interact with the patients the entire time they're here. We are here Monday through Friday. They can start volunteering as early as 7 a.m. through 4 p.m. So again, we have rotating opportunities. We require 200 hours in order for volunteers to get a letter of recommendation. So while we do have some volunteers over the summer or during different months that aren't able to contribute the 200 hours, we welcome them as well, but we're unable to provide a letter of recommendation. Again, those that need the letters of recommendation, you must complete 200 volunteer hours. We do still require, as the other hospitals, the PPE, so it's the mask. For those that want goggles, we do provide them. We don't require them, but we do provide them. So if anyone has any specific questions outside of the information that's been given, I will be here for questions. Again, we'd like to focus on helping the students to enhance their social skills. So a lot of that, we believe, is dependent on listening to the patients, which they're able to do.
Okay, sounds like a lot of opportunities and you're really tuned into the student to help them grow with their experience. Christine, as I hear you.
That is the goal.
Good, good. So with all these different opportunities, we have two representatives from programs here at the university. Deborah from Wayne State School of Medicine and Brittany Thomas from our nursing program. So as you both hear about all these different hospitals and their patient care opportunities, what are you thinking? You know, I know we talk to students about having patient care, but why do they need patient care? Why does that matter? A student going to your nursing program has patient care. How will that benefit them? If anybody here is pre-nursing.
Oh, yes, absolutely. So first, it was just lovely to hear about all of these opportunities that students can have to volunteer, because oftentimes students will call and ask, where can I volunteer? I know that I need patient care hours for your program, and I'm at a loss for where to find those. So I'm so glad that these opportunities were presented. But it's really important for our prospective nurses to have these patient care hours or this experience, because so often we hear that students want to pursue this profession or any other healthcare profession because they want to help people. So patient care hours really allow us to see that the student is actively engaging in the community, helping people in some capacity, and that they're enjoying it. We also want to see that our prospective nurses are able to tap into that altruistic service that nurses complete. For the nursing program at Wayne State, we don't specifically look for patient care hours. We've expanded that term to include all healthcare related service experiences. So this could include patient care hours, volunteering with a health organization or a support group, volunteering at a soup kitchen or homeless shelter. And we really expanded that beyond patient care hours, one, because of the young age of many of our applicants. So we sometimes have students applying to our program directly out of high school. So 15, 16-year-old students sometimes applying to our program. So we realize that all of our applicants may not have the ability to get some type of patient care hour, but they may be able to get some type of healthcare related service experience. Another reason that we did that is because we want our future nurses to think about the ways that they can transform health outside of the hospital or clinical setting. So thinking about how environment, nutrition, and shelter play into health and healthcare, especially when knowing how the many health disparities that people face in lower SES communities, or based on race, based on zip code. So we really want our future nurses to have that understanding that health does not just happen in the hospitals or in these patient care settings. So we want them to be able to relate community to nursing practice. So that's why we have our future nurses participating in some type of patient care or healthcare experience.
That makes sense. That makes sense. But if they did do these hours, certainly that they could talk about them in their application.
Oh, absolutely. We also ask for students, along with submitting hours of healthcare related service experience, we ask that they answer a question to tell us how have these hours played into their desire to become a nurse? What did they learn from those hours? So if they do not have patient care hours, they can talk about those healthcare hours or those soup kitchen or homeless shelter hours and how they have enhanced their ability to become a nurse or desire to become a nurse.
Okay, all right, that makes sense. Now, Deborah, when we talk about physicians, we know as pre-health advisors that physicians have to have patient care. And why is that? Why would you need a future physician? They already know they're going to be a doctor. Why is that important in the application process for admissions to medical school to have patient care experience from your perspective?
First, I want to say it's great, like Brittany suggested, that we have these awesome opportunities for students to volunteer right here in our own backyard, so to speak. So students have, you know, just a myriad of opportunities right here, and they don't have to go far. And so that's a good thing, because for those students that are applying to the medical school, patient healthcare experience is extremely important. First and foremost, for a very basic and just very elementary kind of reason, is that, you know, you won't know if this is truly something that you want to do if you have not had the opportunity to experience what, you know, a doctor does in his day-to-day. So being able to volunteer in these various settings gives you that opportunity to get that exposure, that clinical exposure that we're looking for. At WSU, particularly as it relates to the patient healthcare experience, given our brand, Urban Clinical Excellence, we like to see students who have volunteered in facilities that will allow them to have exposure to a diverse patient population. So certainly the experiences provided by the panelists here today will give them that opportunity. And then also, as it relates to the patient experience, patient care experience for admissions to medical school, we're looking for students to have, we don't have a fixed number of hours that we're looking for, but we're looking for students to have substantive experiences. And with that, we're hoping that students will find experiences that they will want to spend a significant amount of time in those experiences, and not just what I have coined, you know, be experience hopping, you know, so do something for a week and go on to something else, because like nursing, we want to know, what did you gain out of that experience? You know, yes, you're helping the patients, but what did you gain from that experience as well? So any of those activities that can give students that direct hands-on patient opportunity, we're very much looking for that. And so that could be from, you know, volunteering at any of the facilities that are listed here today, EMTs, where you get the direct hands-on patient contact if students are willing to go into that kind of training, CNAs, all of that, that's going to give that direct hands-on patient contact. We really look at that as being something substantive. And then it allows students to be able to also help to, what's the word I'm looking for? The soft skills, help students with those soft skills in terms of communication and enhancing the interpersonal skills when they can have that direct hands-on patient contact.
Like I'm muted there. Okay, looks like there's some definite reasons that you need all that for medical school. You really want to see, has the applicant experienced working with patients and helping out in a compassionate, empathetic way.
Yes.
Well, I just wrote to our students and I see, I just asked what programs they're going into. Looks like we have lots of nursing students and some medical. I'm just writing any other programs. Is there anybody here that's going into anything else besides medical? Do we have any future dentists here, future PA, optometry, anything like that? Okay, looks like mostly nursing and medical. So let's go back to the volunteer opportunities. Nancy, you were going to tell us more details about Beaumont and some of the specific things they can do. So you know your audience is nursing and medical.
Yes, so I know one of the more popular areas for the patient contact are either the patient units or the emergency center. That's where you get probably the most patient contact. So on a nursing unit, one of the things I tell people, I don't like for when people go to a nursing unit and base a decision based on one experience. Every nursing unit, even within the same hospital, is different. So your orthopedic unit is going to be very different than your oncology unit, which is going to be very different than your cardiac unit or your pediatric. So we do have volunteers also in the Beaumont Children's Hospital. So each unit is a little bit different. And so I always like to tell people that going in, this is your time when you're volunteering, where you can get those different experiences on some of the different patient units. And I think that's important when you're looking at, do I want to go into patient care, and what does that look like? And people want the patient care. And I've seen many times where if this is your first experience in working on a patient unit or in the emergency center, it's a little bit, sometimes people stop and say, like, before they go into a patient room and just think, oh gosh, what do I say? What do I do when I go in there? Because if you've not done it before, and it's a little bit unnerving to think, oh, what am I going to say to this patient? And what if they say something to me that I can't, and I don't know how to reply? And that's all part of the training. That's all part of somebody being with you, you watching somebody do it and being there with them, and then doing that with them next to you so that you can become comfortable with it. Other people will go in and be comfortable right off the bat, but it's important that you know that that's part of that training, is just introducing you to that whole patient experience. And the other thing is, each room that you go into, you have a whole different experience because every patient is different. You have different ages, you have different reasons why they're there, different things they may be going through, either not only with their health, but maybe even in their personal life. I remember being able to help. I had a volunteer come back to me and say, I was able to help a patient because he was very concerned. He came into the emergency center, had no idea he was going to be admitted. He lived alone and he had 2 dogs at home. And he was really concerned about
Worried about
dogs at home.
dogs, yeah.
So we were able to get him some help, get a family member or neighbor, I can't remember, over there to take care of his dogs. And then he was able to not stress and worry about that and really focus on getting well again. So sometimes it's just things like that. So on our patient units, volunteers help a lot with things like just bringing fresh water to the patients. All our volunteers can answer call lights, and that's part of the training because anyone can answer a call light. You may not be able to do everything the patient's requesting, but there are a lot of things that you can do for the patient that they are requesting. So answering call lights is big. Discharging patients from a unit, straightening a patient's room. When you think about it, you look at a patient who's sitting in that room 24 hours a day, basically, unless they're getting up for rehab or something. And if you take a look at it from the patient's perspective, what are they looking at here? Workers, we tend to go in and out of those rooms and not always notice what the room actually looks like. Is it clean? Is it straightened for them? How does it look for them? Make it nice for them. I think that's one of the things too, is the experience that volunteers get with it. You're really learning to interact with all kinds of different patients and learning to be where they are. Where are they right now? Are they comfortable? Are they not? Are they worried about something? Are they, so there's so many different aspects of dealing with patients, not just the health aspects, but it has a direct effect on it. So it's a really important piece of that experience. You're also helping when you're on a patient unit or in the emergency center, you're really helping, you're being able to observe too, a lot of what the nurses are doing. So on patient units, you may see some of the physicians sometimes, or the PAs, or some of the other therapies that are coming in. But I think your best experience for nursing is on the patient unit. I think you're really able to see exactly what their job entails every single day when they're there. In the emergency center, you will see a mixture of that, emergency center nursing and emergency center physicians. I know that at our Dearborn Hospital, we used to have it at Royal Oak too, and now since the pandemic, it hasn't come back, but at Dearborn, they've created a student engagement organization. And the students are really looking at opportunities outside of their volunteer role, just to expand the experience that they have. So they're really trying to set up some things for shadowing, being able to shadow physicians. I've always said that I could have a full-time person handling only shadowing requests because we get that all the time. And we don't allow somebody to just come in the door and shadow. If you're a volunteer, you're already onboarded, you've already met all the requirements. Once you start volunteering, there are some opportunities. We do look for the volunteer to take advantage of the situation that you're in, especially if you are in the emergency center or on a unit. Talk to the people that are working up there. If you're interested in going into nursing, ask if you can talk to one of the nurses and ask them questions. If you're in the emergency center, obviously you want to be smart about when it's crazy time or when there's a little bit more of a lull. And that would be the time where you could approach a physician and say, hey, I'm really interested in being a physician. Would you have about 5-10 minutes to talk to me? And start creating those relationships. Ask them if you can shadow them. So I always tell people, take advantage of the opportunities that you have. You know, you don't have to
build that relationship.
You do. Those relationships are so important. I remember having a student volunteer come back, and we didn't know this, but they came back and said, yeah, I'm shadowing my third physician today. And we looked, we're saying, you did. I mean, and that, which was great. That's somebody that's really taking advantage of that opportunity and being able to go in there and ask for those opportunities. I do think you have to make yourself known too. You know, what happens is, especially in an emergency setting, it's very, very busy. You know, if you go to somewhere like Royal Oak, where it's a level 1 trauma center, it's an extremely busy area, and it's a great environment to experience. But there's a lot that you can do. And there's a lot of times volunteers may not feel like they're connected necessarily to the staff, because the staff is very focused on what needs to be done right now. You know, they're not looking at, oh, what is this volunteer doing? Or what is that person doing? They're not focused on you. They're focused on what needs to be done. So as a volunteer, coming in and making sure that your job is done, making sure you've stocked all the things that they need, offering your assistance. When you hear, hey, a patient's being discharged, jump in and say, hey, can I do that for you? Can I discharge that patient for you? Because they may not think to ask you to do that.
So take the initiative more.
Taking the initiative, you know, once you're comfortable with what your role is, I mean, take the initiative and let the staff know where you can jump in and help and what you want to do. There's also some things that I think are, you know, like people tend to not necessarily want patient escort because it's discharging patients. But I love that job for a volunteer because it gets you to every area of the hospital. And it gets you that direct communication with that patient as you're wheeling them out. So again, all different kinds of patients that you're talking to. And sometimes it's a nice introductory way to get used to communicating with a patient. You know, when they're on their way out, it's a short visit. It's very, you know, you're just from the bedside to the door till the family member comes, but it's a nice way to get to learn the hospital, the areas of the hospital, and talk with the volunteers. I don't think that I saw anyone in the chat that was interested in rehab, but we do have positions available in rehab about that, you know, with, like I mentioned, the different rehabs, also in our outpatient facility, like the Beaumont Healthcare Center and things like that. I have a lot of different therapy rehab areas there. And then if you're not interested necessarily in jumping in right away to get into the patient contact, if you're not comfortable with that, we do have other areas too that you can go to where it's kind of like a gentle approach to the patient experience. So even an endoscopy where you're observing a lot and your contact with the patient may be just discharging them out. So there's some different ways too that you can contact a patient or be in communication with a patient, but not on the level of being on a patient unit or emergency center. So we do have different levels. I love to be able to move volunteers from one area to the other. However, I will say, and I like the tiered approach, Maureen, that you have, because I do think, you know, the last thing we want to do is have you come in, get trained to do a job, because I'll tell you what, the training doesn't take place in one shift. It takes a little while to get used to get fully trained. So we don't want, like, as soon as you're trained, you're saying, okay, now I want to move to this area, because we need to create that win-win. So we want you to have a great, meaningful experience, but what are we gaining from that? We want to give you that experience, but we also want your help there. And so we ask that volunteers stay in an area for a little while, at least we'd say like 3 months before you move on to a different area. And there is an opportunity to work in 2 different areas at once also. So somebody might say, hey, my Tuesday, I have all day Friday. Can I work Friday morning in this area and Friday afternoon in this area? Or we might say, I'd like to work Tuesday afternoon in one area and Thursday afternoon in a different area. So those are opportunities too, where you can kind of jump between different areas just to gain that different experience. I don't know. I think that as far as, I wasn't going to go over all the requirements. I think mostly healthcare requirements are basically the same. When we're talking about onboarding, we do background checks. We do the health screening, which is a TB test or QFT, Tdap within 10 years. Most students have their immunization records available, and though, so you can provide those. That will take care of that. We do need the COVID and the flu. And then there's online education that you have to go through in an orientation, in addition to the training in your department. But keep in mind, all of that is to keep you safe, to keep our patients safe, and then to make sure you're properly trained to do what the job entails.
Okay. So a lot of details with each position in terms of criteria to qualify to volunteer, but we can always share that information later with students, it sounds like.
Yeah, there's not much in the way of qualification, just the real desire to be able to do that and the time it takes to do that. And we fully understand too that schedules change every semester. So we're perfectly good with that. We're used to doing that all the time and switching, as long as that communication is open and you're letting us know ahead of time, hey, my schedule is going to be changing in January. These are the days I'm available now. And we'll be sure that we work with you and change the schedule.
Do you have a minimum hour commitment, like Maureen said? I think you said 3 hours, didn't you, Maureen? I think 3 hours.
Yeah, we have like the average shift is 1 shift a week and the average shift is 4 hours, but that does vary depending on what area you're going to. And most of the hospitals are pretty flexible with that, because we understand that you have a schedule too. And we just appreciate the time that you are in there to help. So yeah, we're pretty flexible with this.
About 4 hours. Okay, but flexible. Yeah. And there was a question in the chat about free clinics. Do any of your hospitals have free clinics, like anything in the community? I think, was it you, Lindsay, that asked that question? I think so. Is that something that you have, Nicole, at Henry Ford, any free clinic? Beaumont, do you have free clinics or children's? Okay, because we do have other free clinics that I can get information for you, Lindsay.
Yeah, not that I'm aware of, but somebody posted too about the boosters.
Right,
at least
question about that.
Yeah, at least at Corewell Health, Beaumont. I got to keep saying that because I don't know if everybody knows that Corewell is Beaumont, but we do not require the boosters, just the first 2 or 1 if it was a Moderna.
Okay, all right, and then what about relating some of these questions that we were talking with Nancy, with nursing and medical students? How would you think about that, Maureen? If you had to say, like, you come to Children's, how will that help prepare, students that are here that are trying to go to nursing or medicine?
So I think that, especially like within the tier process, it gives you like a well-rounded view of a different patient's experience in the hospital. So coming in from the ER, going up to the floors, or helping them to a clinic visit. So being able to kind of have those touch points of patients, and then also I know Brittany talked a little bit about this, just being able to feel comfortable talking to patients and families and what appropriate conversation might be. I think that it's a great way to kind of get your foot in the door of being in the hospital and kind of understanding all the ins and outs. Infection control is the big one. Knowing that you feel comfortable in a hospital setting, or maybe you feel more comfortable in certain areas versus another one, or with certain types of patients. So I think it's a great way and a great experience for students to really be able to kind of know where they want to go for their future.
Okay, that sounds good. Just to really get like overall environment understanding. Christine, the same thing? Do you feel like your organization, you know, Carmanis would help students going to nursing and medicine, like to get a, you know, how do you feel about that? You know, like-
Absolutely. Again, I think it's one of those things where we talk about socialization, you know, and them being able to talk to people. We've had students, of course, I'm sure across the board that come in and, you know, some of them are very passive and they don't know how to talk to people. So one exercise in particular that I like to do when we have time for new volunteers is to have them sit in a wheelchair and wheel them to different areas of the hospital so they can empathize and feel the way that a patient feels, as opposed to, you know, just being that it's different, you know, when you're on the other side of that. So we have conversations when they do that. We have them to go in inpatient and outpatient units. They interact with the patients, they interact with the staff. I am very passionate about students knowing that this is what they want to do. So we do everything that we can in terms of, you know, building exercises and having them interact again with the patients, as we all do. But more importantly, I think, because I think about senior citizens a lot. And when you think of them in our population of people, that's two different things that can cause issues. So when you think about the doctor that talks at the patient and not to the patient, we like to get the students to be able to listen, just listen, and to have them to understand how important that is. So to have them to become involved in these rotating opportunities, it gives them a good grasp of what they're able to do and how they should do it when they're dealing with, we're in Midtown and we're in Farmington Hills.
Mhm.
So when they're here or there, they're able to see and recognize that it's very important to interact with people and to listen.
Mhm.
That is very important for us. So in terms of nursing and becoming doctors, they interact with the staff. They are able to assist in different areas, inpatient again, outpatient units. So they're able to see what they're able to do. They're able to interact with the staff and say, hey, can I do this? Or ask questions about what they may potentially want to do and make that determination based on what they're seeing as they're here, which is another reason why we make them responsible for completing 200 hours. I think that gives them a good grasp of what it is that they would actually have to do when
Mhm.
they're working in the medical field, whether clinical or non-clinical.
I think that's so important because we all know from our own healthcare experiences how it feels when we're not listened to as you know, our own healthcare, how important it is to listen, you know, and really hear what the patient is saying.
Absolutely.
That's good.
We've had so many students to come back in one instant and say, oh my gosh, this patient said, you know, X, Y, and Z. And something that's so small to the patient could be huge for students. So I think every opportunity is a great opportunity based on them being able to grasp it and understand the impact that they have, as well as the clinical staff. They have an impact on patients. The patients love the volunteers.
And that's good for the students to see the impact that they can have themselves.
Absolutely.
Oh, that's good. Well, Nicole, as you hear all this, what are you thinking? What else can students gain? You know, is it some of the same things that Christine was talking about, the value of listening to the patients? What else do you want to add about Henry Ford Cancer Institute? Because it's so important to have someone there to listen as a cancer patient.
Yeah, definitely. I think our roles offer a lot of the same things that everyone else has been talking about. For students that are pursuing medicine or nursing, we do offer that kind of clinical experience interacting with patients, learning how to communicate with patients, showing empathy, getting some opportunities to observe, medical staff. Typically it's nurses that the volunteers are interacting with, and just seeing kind of what the working environment is that they're in, and how they are interacting with patients, and kind of learning what to do and what not to do based on that. I think very similar to kind of what everyone else has been talking about.
Do you have the training that Christine was talking about, where you actually like maybe do some role playing with possible volunteers? Like if they're shy, it sounded like some of yours were kind of shy, weren't they, Christine? A little
Yes.
hesitant to talk. Do you do some of that too, or?
We don't do that specific training with the wheelchair, although I do think that does sound like a great idea. We do talk quite a bit about empathy and kind of thinking about how you would respond to a patient when they share that they're not feeling well or share a hardship that they're going through, and kind of walk volunteers through that in an exercise.
Great, that sounds wonderful.
Yeah, and then also kind of here when they're here for their first day, as with other organizations, we do provide some on-the-job training and provide some other volunteers that support while they are here for their first couple of shifts, to kind of walk them through what they're going to be doing in their role, so that they're feeling comfortable when they're doing it alone for the first time.
Okay, great. Well, Brittany, you're hearing all about all these details of these hospitals. What are you thinking as you hear all this, as far as our future nurses?
I think that our future nurses have some wonderful opportunities that they can tap into. And I truly hope that every student on this call goes into at least one of these volunteer opportunities. Just to hear you all talk about the way you put empathy into those volunteer experiences, and just the connections that they're able to build with not only volunteers, but hospital staffs, and make themselves be known in those locations. It's really, really important. And I just want students to have that understanding that the volunteer experience that you have before coming into the nursing program, that's going to set your tone for how you go into our nursing program, and bringing in that empathy, bringing in that thought that I truly want to give back to others. I want to give my time, not just as a means to an end to get into this program, but we want that to be a way of life for you. We want you to recognize that your patients are people who, after that interaction that they have with you, they will carry that interaction with them for days, and maybe for the rest of their lives. Like, I think about some of the nursing faculty in our program who talk about the patient care experience that they had when they were practicing nurses. And they tell so many stories about those patients who impacted them, and who made them recognize things about themselves that helped them to become better nurses, helped them to realize ways that they may have talked to patients in the past, and now they were able to talk to them differently. So it seems to be such a great exchange between the volunteer and the patients, where the patient is receiving that comfort and that care, but the volunteer is learning so much valuable things that can't be taught in a classroom. And I'm just hearing so much wonderful experience that our students are able to bring into this program that can help them to become wonderful nurses, or any kind of healthcare profession.
And really, the volunteer experience is where that starts, with their patient care experience. and being able to learn what does it mean to be compassionate with a patient, whatever the setting, whether it's with cancer or at emergency setting like you were mentioning, Nancy, or with children in the playroom or by their bedside, Maureen. It really starts, with the volunteer experience if they choose that.
Yes, and thinking of when Christine mentioned how some of the volunteers can come in and be quite shy sometimes. And I think it's so important because, especially coming out of, or we are still in a pandemic, but for the nursing program, how we do admit many students directly out of high school or very young students. Many of those students have had their last couple years of high school or their first year of college, last year of high school completely remote. So to be able to get back into that social engagement that they're able to have and start to develop those conversational skills again, that's very important. We actually removed the healthcare related service experience during the bulk of the pandemic. So we did not require these hours from 2019 until 2021. So this is our first year bringing that back. But I can say that from some of the students who we have admitted during this pandemic time, many of them have talked about how it was difficult for them to come back into this in-person time and navigate classes, navigate conversations, talking with patients. So this experience that you're able to have prior to beginning whatever healthcare program it is that you begin can truly help you so much.
Thank you. Thank you. Deborah, as you hear all these panelists talk, what are you thinking? The same question I asked Brittany. What else can students that are going into medicine do? I know some of the panelists talk about they have to wait. I think you said, Nancy, for a certain number of hours to get like a letter. And I think you said that too, Maureen. So in terms of those letters or shadowing, I know Nancy was talking about building that relationship to get that shadowing. What else do students need to have when they're going to go to your medical school in terms of patient care? Obviously, the shadowing is a good idea, but what else would you like to see? Not patients, students, I'm trying to say. Talking about patients.
Right.
Yes.
I get it, Helen. In addition to the patient care experience, I mean, that's super huge for us at the medical school, because again, as I stated earlier, it gives us an opportunity to assess whether or not a student has been truly committed to this goal of becoming a physician. And they demonstrate that to us through the activities that they have been engaged in. So like I mentioned earlier as well, to have this wealth of opportunities right here on the WSU campus for students to experience volunteering in whatever setting that they choose is, just really, really remarkable. We don't have a fixed number of hours, like I said, but for students who are thinking about medicine, in terms of being considered a competitive applicant in the types of activities that you've engaged in, it's gone up a little bit in terms of the range of hours that we're looking for. So, you wouldn't want to think about maybe something in the range of 500 hours thereabouts. Again, no fixed number. So if you had less than that, it doesn't mean that you would not be competitive, but you do want to get those experiences. And again, the more diverse the experiences can be in terms of the types of activities that you engage in, the better. Certainly, if you're coming into medicine and you feel like that you want to be a pediatrician, and therefore you have, done a significant amount of volunteering at Children's Hospital, that's great because it shows that, commitment to that particular specialty. But we still like to see that diversity in terms of the types of healthcare experiences that you call, because it lets us know that you've had the opportunity to connect with a diverse patient population, different backgrounds, different cultures, all of those kinds of things. And it's only going to help to enhance your well-roundedness when you apply to our medical school. So bottom line is just take advantage of all of these opportunities that are right here in your own backyard.
That's great advice. Great advice. Well, are there any questions that students have at this time? I want to come back around to the panelists and see if they want to share anything more. But I also want to ask students, I know we've been asking, or I've been asking lots of questions from the list of questions I sent out, but I realize that you may have some questions, and some of you have asked some things in the chat, but are there any other questions? Feel free to unmute yourself. If you want to show your picture, feel free. If not, that's fine too, or write it in the chat and I can read it. Any questions anybody has? Well, let's go
I
back.
just want to mention that a student just asked me a question in the chat, but I want to answer it for everyone. So the question to me was, is it better for a variety of volunteer hours? Now, for our nursing program, since we are only requiring 10 hours, it's very rare, I will say, that we see a variety of hours in this 10 hours because for a lot of places, they may require a student to volunteer multiple days or make a certain commitment. So for the nursing program, it does not necessarily look better if a student has a variety of volunteer hours or if they are only volunteering at one place. I will say that consistency is in showing that you are dedicated to a particular place is going to look good, but that is not what we score students based off of. So if you have the 10 hours, you're going to get the full points for those 10 hours. We have that question on our application that asks the student to talk about that healthcare related service experience and how it has attributed to your commitment to want to become a nurse. And answering that question, a student could talk about their variety of volunteer hours or pull in more things than just those 10 volunteer hours that we require for our nursing application. But again, it does not necessarily make a student a more competitive applicant by having a variety of hours, because we just need to see 10 volunteer hours for our BSN program.
Okay. All right. So the variety is not necessarily the focus point. It's more just the 10 hours, but if they
And
have
being able to articulate that helping nature.
I got you. Now, one other question that I do get with not just pre-nursing students, but when I was pre-med, is how can I learn more about opportunities to go into in the future, like nurse practitioner, or let's say I want to be a specialist in a certain area. And I always try to tell students when I was doing pre-med advising, you don't have to make that decision yet. That's what comes down the road. But when you think about all your volunteer opportunities, how would that help a student? Say I have a student that really wants to work with children, Maureen, how would they be able to understand, like, if I want to go into like a practice someday as a nurse practitioner, or maybe I want to be a pediatrician?
Sure.
How would their volunteer experience at Children's help them toward that, one of those goals?
So kind of building off what I spoke about before, just being in the hospital and getting to know the environment, but also being able to, especially once people move kind of up in our tier system, especially at bedside or in the activity centers, being able to see those interactions between a nurse practitioner and a child and family, or a pediatrician that's coming to do rounds. So being able to observe from a volunteer standpoint, similar to Nancy, we also offer shadowing opportunities. This actually goes through our HR department, so it's not through me, but helping to connect students that are interested. But I think being able to just observe just those interactions from, job to job, or if there's other things that they are interested in. We do have a lot of placements, even that there are some departments that maybe could use one volunteer that might not be on the list. So if there's something that people are really interested in, I'm happy to help them in any way that I can.
Okay. And Nicole and Christine, I know your population is specialized with cancer patients, but let's say a student is thinking about beyond, just their bachelor's degree in nursing or beyond, medical degree, going into a specialty, obviously on oncology, but how would they relate their experiences at your hospitals to like the future in terms of not just being a nurse or being a physician, but going further in nursing or going further in medicine as a specialist? And either one of you, whoever wants to answer. Nicole, you look like you're ready.
Yeah, I can go ahead.
Okay.
So we have stopped allowing shadowing within Henry Ford in general, but in response to that, I have started kind of a speaker series with some of our physicians and other staff members here. So, nurses, APPs, dietitians, social workers, everyone like that, just to give everybody an opportunity to kind of hear from different staff members within Henry Ford Health Cancer. And so it's brand new. So we have started to invite volunteers to that. So that is an opportunity to kind of learn more about other roles that you might not have an opportunity to interact with necessarily when you are here volunteering, but just to kind of expand that a little bit. But, we do have volunteers in a variety of different areas in the building. So just kind of approaching other staff members and kind of asking what they do is probably the best way to do that when you're here in the building.
Okay. Same for you, Christine, just kind of talk to people.
Yes, for the most part, we do have outside events where they're able to assist and interact with people that are not necessarily in the medical field. We have symposiums where they're able to interact with people there. So there are a lot of outside opportunities as well as inside opportunities. So yeah, it just goes with interacting.
Okay. And Nancy, I have a lot of students that are thinking about nurse practitioner. I would think there'd be lots of opportunities at Beaumont to get that kind of exposure.
There are, but again, it's going to be the same thing, wherever they're working as a volunteer, it's asking the question, are there nurse practitioners on this unit? How can I talk with them? Again, taking advantage of that opportunity. Another thing I wanted to mention too, is we get a lot of requests too for special projects that we open up to all the volunteers across the system. So for example, we have a basketball camp that we do every year. Well, we don't do it. We partner with Derek Coleman, who's a former NBA player and mentors. He spends a lot of time mentoring. And so he pulls together this basketball tournament every year. And so volunteers go in with some of the other Beaumont people to help screening at the event, again, keeping everybody safe, giving them materials and just helping them at the basketball camps. And that goes on for I think it's 4 to 6 weeks or something like that. So it just gives people, you may be volunteering on a patient unit and then you see, this email come through to you and say, hey, there's an opportunity to volunteer at this basketball camp if you want. And you can sign up for 1 shift or 3 shifts or whatever you want to do. We're also participating in some of the community flu clinics. So we partner with some of the different companies to provide flu vaccines, and volunteers were asked to help with those kinds of things. So there's a lot of different opportunities with projects on the side too. That is really nice. And people like to do that. We've done that even in the emergency center. So when every once in a while, the emergency center comes, it would be at Royal Oak usually, we'll just say, hey, we're in a surge right now. We've got so many people, we need help from whoever. And I send an email out to all the emergency center volunteers and say, we're in a surge right now, all hands on deck, anyone who can come in 24/7, just come in. You don't have to announce it to anybody. You don't have to sign up for a shift. You just come in
and help.
Just come in, and we've had great response from that. So I had one student that actually went in on the midnight shift, And I had the nurse supervisor email me that night and said, can we have volunteers every single day on the midnight shift? Because it was so helpful. But it's a great opportunity like that too, other than what you're doing as a volunteer, whatever your role is there. There are other opportunities to get involved too, and in different projects, different from what you're doing as a volunteer.
Great, great. Well, I'm going to share this recording with all the students that came. And then, like I said, we have this YouTube channel with our Pre-Med Health Science Center, so we'll share it there. Do I have all of your links? I think, Nancy, you put yours in the chat if they want to volunteer. Christine, Nicole, Maureen, do I have all yours?
Mine's in the PDF that I sent.
Okay. And Nicole, I have yours. Oh, you just put it. Okay. And Christine?
I'll put it in the chat.
Okay.
Thank
So
you.
I will share all those links. I can share the videos too, and I'm going to share your slide deck too, Maureen. So great, great. Well, this has been so helpful. Any other comments that anybody wants to make? Was this, I know we're losing some of our students here. They probably have classes to go to, but was this helpful to students here? Are you guys enjoying this? Autumn says yes. Okay, thank you, Autumn. Any other comments that anybody wanted to share? Was this good for you all too, that you could see what other hospitals are doing, hopefully? So.
I have one comment, and it came to me when another question came into the chat. So earlier, I believe it was Nancy who mentioned that when you're volunteering at the hospitals, you may be placed on a number of different floors, and to not necessarily let that experience that you have on that one particular floor determine whether you will be a nurse or whatever healthcare profession you may be. So the question that I was asked was along the lines of, if I want to be a certain type of nurse, how do I get that volunteer experience? Mm-hmm. And I wanted students to know that when you're in our nursing program here at Wayne State, every semester after your first semester, you have your clinical experience. So that's where you have a portion of the class where you're in the classroom getting a lecture. And then there's typically an 8-hour shift that you have in the hospital setting. For our clinicals, a student will actually go into each of those floors of the hospital. So we have a clinical where a student does OB, a clinical where a student is on a pediatric floor, a clinical where a student is on working with psych mental health, community clinical for students who may want to work in schools or in homeless shelters. So our students are able to get a variety of different experiences while in the nursing program. So a student doesn't necessarily have to know exactly what segment of nursing they want to go into when doing these volunteer experiences. I think for our nursing program, we're really just wanting to see that students have had a little taste of volunteering, a little taste of some type of patient care or healthcare related hours to know that this is something that they would like to go into. And then once they're in our nursing program, they get exposed to the different types of nursing that you could possibly go into. And then we start to talk about the master's, doctoral programs that can lead to you becoming a nurse practitioner in a variety of different nursing professions.
So they're introduced to it as they go through the bachelor's. They learn about the master's and the doctorate.
Yes.
Okay, that's good. Deborah, same thing in med school. I know there's clinicals there too.
Yeah. The only thing that I wanted to add about the medical school is that with the volunteer hours, I don't know if Brittany mentioned it, and I know I didn't earlier, but for us, you can certainly have paid or unpaid volunteer experiences. And so I always tell students if they go for the paid experiences, it's a win-win for them because, again, not only are they getting the opportunity to cull these skills and glean these skills, but they're also able to make some money as well. So you don't have to feel like you can't take on a paid experience and count that in your application for medical school. And just want to leave with this portion of the application, not that any not that all of it is, you know, at the medical school, we do holistic review. So all of it is important, but this is extremely important because if you can have the greatest application in terms of the metrics, you've got the great GPA, you've got the great MCAT score, you have wonderful letters of recommendation, but if you have very limited or no patient healthcare experience, then that will certainly put you at a serious disadvantage as far as, you know, being considered for invitation to interview and ultimately earning a seat in our medical school. So it's just that critical. So you want to make sure that you take advantage of these opportunities that have been presented here today.
Thank you so much. That's an important point to make, that it's not optional. They really have to have the patient care for medical school and also for nursing. But you made a good point, and that's what I was just writing in the chat, is that it has to be volunteer for those 10 hours. That is not an option to have paid, whereas medical school for those patient care hours could be paid. But for nursing, those 10 hours must be unpaid.
Correct.
Okay, so we have covered the bases with that. So, well, I just really want to thank each of you for your time, for your expertise. Just really appreciate you sharing about, you know, each of your volunteer opportunities. Is there any other things? I think we've covered it all, but is there anything I missed that you just want to say before we end here? Or students, is anything? I know I saw lots of comments about how much this is helpful. And like I said, this will be shared for those that couldn't make it today. Going once, going twice?
Well, thank you for hosting this,
Oh,
everyone.
you're welcome.
Ellen, I always love to participate in this and get a chance. I do miss the in-person where I can actually talk to the students, but hopefully we'll get back there someday.
I'm hoping to bring that back next year. That's my.
Well, thanks for inviting me again.
All right.
Appreciate
Well,
it.
thanks
Thank
for
you,
coming,
Helen.
each of you. Thank you.
Thank you.
And I'll
Thank
send
you.
this out to everybody.
Thank you.
All right. Thank you. Thanks, Brittany. Thanks. Hon.
Thank you. Thank you all for being here.
All right. Thanks, Desmond,
Okay.
for the help.
No problem. Thank you all for being here.
Thank you.
Thank you.